I will show you exactly how to decide when a tooth should be extracted and when you can leave it. So I hope you enjoyed the course, and I will see you later on Instagram.
So now you have the patient on the table. And the next thing I just want to briefly talk about is that's something that can be a little bit subjective, right? Because back in the day when I started, I was taught that if a tooth is loose and mobile, then it needs to be extracted. If it's completely stuck, then it's fine. And that was before the days of full mouth X-ray, where we found out that even if a tooth is not able to move, it may have periodontitis, may be diseased. So when should we extract the tooth and when can we leave it? So let's just say that you don't have X-ray and you need some sort of measurement to say, okay, this is when we should start considering extracting a tooth with periodontitis. So when you have a cat and you have a 2 millimeter pocket, that's nothing, right? But in a cat, it's actually a lot. Then you may consider extraction. If a dog has more than 5 millimeter pocket, you may consider extraction, or at least opening up the tissue, make an open root planing, meaning that you make a flap and you clean up the tooth and then you close the flap again, which is getting us more into advanced stuff. But let me get you some examples. What I do, and I think is very important when you examine the mouth, is you probe before you clean. I start with full mouth X-ray as the first thing. I don't care if there has calculus and tartar on the teeth. I can see what I need to see below the gum line on the X-rays. You can see a shadow on the teeth, which is the tartar. But what you need to see is bone loss and so on, which is very clear on the X-ray. So I do that first. Then I put it on the back and I start to use my periodontal probe around the circumference of every tooth. So I measure the pocket depths all the way around the tooth, and I note on my dental chart what the pocket depths are. I don't note when it's normal. So below 3 millimeters, I usually don't note. So see, in this case, the probe went straight through this tooth. And this is the rule of thumb. When it does that, you have to extract. There's no saving such tooth. It's extremely complicated to try and do it. You need an owner that can brush every day, that can do all you recommend. And if it got to this point in the first place, they are probably not prone to brushing anyway. So this is the way I like to keep them on the back, because it's so easy for me to see the entire mouth. You can just put the head from side to side and see everything. And let me see the next one here. Okay, what I'm looking for is signs of when should we extract a tooth, right? So in this case, when you see pus here, this is some bleeding and some pus. I only touched it slightly with my periodontal probe. Then you know there's a pocket here. Okay, there's going to be pus there. If we just clean this and send this dog home, you can be sure that within 1 week there's pus again. And this is a progression. So in my opinion, you should really extract this tooth. We didn't even take an X-ray yet, but just by knowing this, I would extract this tooth. I know it's going to be a problem. The reason why it's such often a problem between these teeth is the lack of a gingival color. And a gingival color is the gingiva that surrounds the teeth. Every tooth needs gingiva, like in this case, to surround the tooth in order to be healthy. And when they are crowding too close together, there's no gingiva protecting each tooth, so it will collect dirt and stuff. In this case, we have a nice gingival color. So this, for a change, this is a healthy intersection between these two teeth. There's usually always a pocket here. But look at this. There's no gingival color. The teeth are contacting each other, which means that there's going to be pockets and disease. So you may consider extracting this one, even without taking an X-ray. This is something I just want to show you, because this is a very, very rare case. This is a brachycephalic dog with crowding, but a gingival color around every tooth. So this is first, only and last time you'll see a brachycephalic dog looking like this. This is the 1 in a million case where it has not enough room for the teeth, but they're actually very healthy because there's a gingival color around every tooth except here. So look for this. This is a sign of health. Once you have a furcation exposure, so as I said before, this is an extraction. You don't need an X-ray to say that. When you have gingival recession like this, so the gingiva, what's supposed to be across here, it has pulled back. Then you look at, okay, how much gingiva do we have left? And what I mean by that is how far is the distance from the gingiva here to the margin between the mucogingival line. And the mucogingival line is where the gingiva becomes mucosa, which is the soft part here, and the gingiva is solid attached to teeth. So you need at least 2 millimeters of attached gingiva for a tooth to be healthy. So in this case, there's more than 2, so this tooth could be saved. But just tell the owner that there's root exposure, meaning that the surface is going to be rough and you need to brush it to save this tooth. If they're not going to brush, then this tooth eventually will become so bad you need to extract it. This is a case, another rule of thumb. If your periodontal probe goes all the way beyond the mucogingival line, which is this line, go all the way up here into the mucosa, like you see, this is the depth that I've reached, then you have to extract. And I know it's a pity, it's a nice looking canine tooth. It's such a big tooth and you want the dog to keep it. Just keep in mind, if you can probe through this line up into it, don't force it through, but if it just slips into and slides all the way down to there, you can be calm and have confidence and tell the owner, this is not going to get better. There's no possible way you can clean it. If you want to clean this, you have to do advanced regenerative procedure to save this tooth, which is often not feasible. So in this case, it's an extraction. So it's easy rule of thumb for you guys. Let's look at the cat with the 3 millimeter pocket. Okay, 3 millimeter is nothing, but in a cat, it's actually a lot, because look at this on the X-ray. You can see this is the space, the spot where we did the probing, and you can see almost half the root's length. Let me go back. Almost half the root's length has been exposed. And we look at the bone loss. And the way I look at it is I see this gray area, which is loss of bone, so the dark area here, and you see and you always go for the deepest part. But you can see the upper part here, there's a line, and then there's a line here. And that means that, so the surface of the bone is not horizontal. It may be oblique a little bit. So that's why some part of this root has been exposed all the way down halfway, and others not so much. You can see what it's supposed to look like here with this spike. So this is pretty bad. So see how much info we can get just without looking at the mouth without even taking a single X-ray. But we want to go a little bit deeper than that, don't we? So we would like to get some help to how to interpret these X-rays when talking about periodontitis. And the way you do it, so it becomes not a subjective measurement, but an objective, is you use this formula. So PD2, 3, and 4 is the things you will write on the chart. 2 means less than 25% vertical bone loss. PD3 is 25 to 50. PD4 is always an extraction. It's more than 50% bone loss. And it looks like this. PD2 up to 25% bone loss. And what we mean by 25% is you take the length from where the crown stops to where the root tip is, and this is 100%. Okay. So if you have a shadow down to here, this is within the green zone, this is 25% bone loss or less, meaning that you don't have to extract, you can go down and clean with the curettes that I showed you. And then you can save the dog home. If you go down in the yellow zone, then it's almost half the root length that has been exposed. And once you reach your yellow zone, it's often an extraction, unless you have an extremely dedicated owner who can brush every day and come back for cleaning in 3 months again. And so usually it's an extraction. If you go in the red zone, where you see the shadow extend all the way down, more than 50% bone loss, then you have to extract. Okay, so this is some 3-step way of knowing when to extract and when to keep. These are some examples. PD2, you can see the shadow go down to here. The lowest part, don't look at the opposite, look always at the worst part. So the lowest part here, and this is PD2. PD3, you get close to 50% bone loss on this root. And so I would extract that to try and save this one. In this case, you see PD4, because you can see that the dark area here circumferences this root, and more than 50% of bone loss has been happened to this root. And here we are almost at 50% also on this root, and a furcation exposure. So you need to extract that tooth, obviously. And this one has a guarded prognosis, but if you can go down and clean this up, if you just pull this out with your finger, if it's that loose and you just pull this out, do nothing else, then you have not really helped this tooth. And you need a miracle for this tooth to be healthy. But if you extract this and you go down with your curettes and you clean out this area for granulation tissue and infected tissue and so on, then you may save this tooth. So next slide. PD3, in this case, this is a distal root. You can see that the bone loss is almost at 50%. What I would do is I would extract this tooth, the 3010, and clean out this area so you can save that. But if you have a PD3 where there's no tooth that you can remove to try and hope for a healing, remove any obvious cause that can make it better. There's no obvious cause here. This is just, you would have to extract this one. I would extract that tooth, definitely. PD4, again, this is an example. And I want you to look at something here. I want you to look at the periodontal ligament. And the periodontal ligament is that black line surrounding the root right here. It's a very thin black line, and all roots needs to have one. And you see the thin black line here, but here the line becomes very thick, and that means that periodontal ligament space has been opened up. Okay, so it means that there's bone loss all the way around this root, and this is a PD4. And if you push down on this tooth, it will most likely be a little bit mobile. So you have to extract that also.
Hey, thank you so much for watching this video. I hope you liked it. If you want to get more confident in treating dental patients in just 6 weeks without going to a physical course, write me the word coaching in the DM on Instagram for a free 15-minute call with me, where I will lay out a plan for you how you can make that happen in just 6 weeks. So please feel free to reach out to me if you want to book a free call with me, where we can discuss how I may be able to help you even further to reach that goal pretty quickly. So see you on Instagram. Bye bye.